coronavirus lockdown has been really harsh on many of us. Even today, we are facing a grave issue of the coronavirus lockdown, of the pandemic. Still, the cases are rising each day, and many of us have been working from home ever since the lockdown was first announced on the 24th of March. It has been a lockdown for a long time. Some states are unlocking, and still, there are certain cities where lockdown has been reimposed. So all of us are facing issues. Many of us are working from home. From outside, it looks like a comfortable setting. But many people have realized that even working from home has taken a toll on their mental health, because when you are at home, apart from the office work, you have to manage your household chores as well. And many people have complained that the work pressure has increased, which has led to more and more mental issues. So in this episode, on Oneindia English, we will decode all of this, and we are joined by the consultant psychiatrist, Dr. Ashish Pakre, who is a alumni of AIMS Delhi. Thanks a lot for joining us, sir.
Yeah, hello Anubhuti, and thank you for inviting me on this important discussion.
Yeah, so sir, in this episode, we will talk about that how the coronavirus lockdown is taking a toll on our mental health, especially on people who've been working from home for a long time. We know that a lot of people have been stepping out who are a part of the essential services, but apart from that, it looks like everything is all right, and yet people are complaining that now it is becoming difficult to continue to work from home because the working hours usually get extended. So what is your take on all of this? You have also dealt with a lot of patients, you said, have complained about the same thing.
Okay. Yes, Anubhuti, first, the most important task is to understand the situation and dynamics which we all are facing right now. See, a lot of, whether it's a government sector or a private sector, whichever place you deal, people are advised to work from home. We need to understand the dynamics of working. The working place, the atmosphere which used to be before has changed. Along with that, there is a huge pressure or psychological impact both on organization sector as well as on the people or whoever is working both. We need to understand that although it's not a very short term effect, because right now some 3-4 months already passed and still we do not see that it is going to get over soon. So we need to understand that the new work environment which some people may find is easy to adapt but may not be feasible for others also. Now what is happening with the this change environment, the discipline, the routine which has changed, lot of pressure from various domains like economy. People are fearing they may lose job, they may face
Yeah.
termination, there will be financial cut or shortage of whatever salaries they are receiving. They also worried about their family members as well as colleagues. The
Yeah.
social support, the social life of people is definitely impaired, which is not the case. So we need to understand how to build, how to nurture, how to build up some support system which can help us to get rid of this new stressful environment. So it requires a support system from both sides, the organization sector, the management, the senior, the topmost people who are working, who are running big corporate organizations or any government sectors. They need to understand the people who are working, they may have innumerable reasons where they may be facing vulnerability in the form of stress, anxiety, depression, sleep related problem, finance related worries. The communication from top management to the down, that is very important. And the senior most management should understand that they have to develop some sort of
Yeah.
strategy which can help people to build up a better communication, better understanding the stress level, whatever the mental health issues which are cropping up, what are the psychological impacts which are emerging. They need to sort it out. If there is difficulty, they definitely
So,
should seek some
yeah.
professional guidance right now.
Yeah, so sir, one of the things that many people have said that the work-life balance completely has been damaged in this lockdown, in the coronavirus pandemic. Most of the people now, even all the meetings are being held online. Earlier, people used to travel, they used to be change of place, they used to take out time to socialize, but now we know for a fact that everybody is confined inside and they're only stepping out for essential services. Now we see that even today, the number of cases have gone past 30,000. So even we are at a very dangerous time here in India. So the work-life balance has been completely damaged. So how should people restore that? Now that we know that this is the new normal, we cannot help it. We might be facing the similar situations for a longer time, for many more months to go.
That is very important, and here we need to understand that the situation, the environment is not very easy, and it is not going to change over a period of few months also. Now we have to understand that how to deal and build up some strategies which equip us to deal these kind of new changes adequately and without causing any psychological harms on our health. At the same time, maintaining the productivity as well as social life. So we need
Yeah,
to now develop, since if we look at the scenario, like on weekends people are not able to go out, movie theaters are closed, shopping
yeah,
malls outside, those activities where people used to go out and eat and enjoy, those kind of leisure activities, travel, tourism, gatherings, these sorts of activities which are socially enriching for people, those are difficult to engage. Now we have to understand that this situation will remain. We have to develop some sort of mechanism like online activities, or after taking care of the risk for infections, and some strategies like using technology where one can have relationships, one can have friendships going on, emotional support system through the use of technology, connection with family members, with relatives, with colleagues, the peer support system from the organization. They have to develop new mechanisms so that the previously the connection which was very comfortable, that sort of some, if not that extent, but some effort should come and
yeah.
some new
So
mechanism should be developed.
yeah. So, sir, one of the major things that people are facing at this point of time is that there is a kind of a fear over job security. A lot of people are facing job losses. There are pay cuts happening. So, at this point of time, many people are facing mental issues overall, not just about the job. So, there is a pressure on people that despite having facing these mental issues, they are forced to perform in their jobs, and it becomes very difficult for people because there is a fear that what if we don't perform, we might lose our jobs. So at one point they are already facing a lot of mental issues, and on the other hand there's an extreme pressure on people at this point of time to save their jobs. So how to deal with that pressure?
See, here are some dynamics which one should understand. Definitely, there is a pressure on people to perform, as well as they also have fear that they may lose job even after performing.
Yeah.
Contrary to this, if even if they perform, yeah, they are facing some kind of psychological impact, the productivity, the performance will also deteriorate. So understand that the damage is occurring from many sides basically. So one has to understand that the family members or the financial, the other sources, if they are available, one should understand, they have to think that even if they are at the verge of this thing, whether they are feeling extreme sadness, or the anxiety is too much, or apprehension is too much, sleep related problem, then if they are not able to handle on their own, or with the help of colleagues, friends, or family member, they should definitely seek professional help or guidance, whether this kind of situations they are facing and they are not able to handle, how to emerge out from this situation. So one suggestion will be, definitely person who is alone or these kind of, because the pressure is continuous, it is not like 1 or 2 day phenomena, it is going to remain. So it is advisable to take external help, take second opinion sort of, and discuss the kind of stressors going on, what should be the optimum or right approach to go ahead, whether it's a job related issue, whether it's health related issue, or managing interpersonal relationship. So
Also,
that would be
sir,
the thing.
at this point of time, even before coronavirus, there was an economic slowdown, and many people were battling with their jobs. Many people lost their jobs. So, a mental stress due to jobs has been there for quite some time now. So, at this point of time, now under lockdown, things have worsened. But when should a person realize that it is time to seek some sort of help? Because in most of the cases, we are tend to this kind of pressure. Even before the lockdown, people were facing pressures in their jobs. People have been working for a lot of hours, and in this lockdown, the number of hours that they've been slogging has even increased. So, when is the point that a person should realize that yes, now there are certain symptoms or there are certain changes that the person is facing, and the person should realize that now is the point to finally seek help?
Yeah, that is very important question, Anubhuti. Let me emphasize this thing. Whenever be it in job or any kind of situation, any kind of stressor one is facing, whether it's in whatever government sector or private sector, if a person feels they are having sadness most of the time during the day or over a past few weeks or more than that, they are having negative thoughts persistently about
Hmm.
life, about the outlook of their career or job, the interpersonal relationship, whether it's with the family members,
Hmm.
husband, wife, or any sort of, or they are not able to enjoy the daily routine or daily pleasurable
Hmm.
activities which they used to enjoy. There are frequent anger outbursts, irritability.
Hmm.
There is, if the family members or colleagues notice the said person is usually cutting off from usual interaction, not able to enjoy the things or
Hmm.
gathering which they used to enjoy. There is a change in behavioral pattern,
Hmm.
frequent irritability, numerous issues at workplace or at home, which
Hmm.
with the help of family members or colleagues they are not able to sort out. And they
Hmm.
find if someone is also reporting, they are feeling like overwhelmed, they feel like just giving up on the kind of issues going on. That is sometimes, or before that also, one should go to external help to discuss those kind of issues. What should be, what should they take, the guidance or the
Hmm.
approach they should follow. So whenever you one feels overwhelmed and one does not find any way, before that also one, it is
Hmm.
always better to take prevention than be late.
Yeah. So, sir, one thing that many people are facing, which we might not discuss openly, is that whenever people in during this setting, we know everybody is suffering in some way or the other. Many people have lost their jobs. Many people have lost their sources of income completely, and yet there are people who are working from home comfortably. So, another issue that some people face is that they don't feel comfortable enough to come out and say that they are having certain mental issues, because of the fact that when we say that we are not having a good time, most of the people react in a manner saying that everybody is facing the same thing. So whenever somebody even tries to share this, that I am kind of in a stress, or I am having anxiety, or somebody says that I am irritated most of the day, so most of the replies that we get from families and friends, not in every case, in many cases, is that you're not the only one who's suffering. There are many others who are also suffering, and people are suffering even worse. So in that case, it becomes even difficult to put across what you're actually going through.
Yeah. So here, that is also one important question, and it raises so many important concerns. I'll tell you. One is awareness about the issues. Second is
Hmm.
sensitivity towards the concerns the other person may be facing. Third is
Yeah.
stigma about
Hmm.
mental illness and those kind of
Hmm.
issues, and perception.
Hmm.
Awareness in the sense, if society, the people living in society do not have a good understanding that what it is like to,
Hmm.
if somebody is feeling sadness or somebody is having a very difficult time which they are not able to handle, usually things go in a very friendly or casual approach. So
Yeah.
one, the need is to develop some sorts of mechanisms where the public or massive section of the population or nation should be aware that these kind of issues are important
Hmm.
and they should be given due consideration. Second is stigma. Stigma in the sense, usually there are a lot of myths and misconceptions still prevalent in society. We have discussed previously also regarding depression, antidepressants, the kind of belief system which
Yeah.
exists, which prevents people from seeking help, because it appears like weakness in character, weakness in some personality, those kind of issues that
Yeah.
someone is. So unless there is a sensitivity all around the person who,
Hmm.
where one is working, and if they feel confident to share and they receive a response which is receptive, which looks supportive, which looks emotionally connected, the person will not be able to open up. So we need to
Yeah.
develop more and more discussion on that line, where the person, the society which is ignorant, who lacks knowledge about the mental health
Hmm.
issues, they understand if someone reports that they are not able to perform job, they should be, they should understand there is some problem and they should dig deeper and provide
Yeah.
support rather than shun them down. Okay,
Yeah.
it's a natural thing. So need to understand. And stigma also requires a lot of work to be done right now, and
Hmm.
pandemic is definitely is one pressing concern right now.
Yeah. So, sir, one thing is that many of the people who are facing these kind of mental issues in their jobs are also scared to let people know, their colleagues, their bosses, that they are having some sort of mental issues, because then they will be in the limelight, and they also fear that they might lose their jobs, or their peers or their bosses, they might looking at them in a different way altogether. Even if they're trying to work really hard, there is this kind of fear that what if the other person knows that I'm facing some sort of mental issues, it might be a risk to them. So what would you suggest to such people that cannot really express themselves openly because they're afraid of the fact that they might lose their jobs, because of the fact that if it comes out in the open that they're having some sort of mental issues right now?
See, here also those important concerns which we discussed in previous section. First thing, mental illnesses are preventable, they are treatable. There is nothing like it's a very the society norms or perception which is so like stigmatizing those kind
Yeah.
of issues which need to avoid. There has to be a public, whoever is a public or any person who is facing this should be, they should go to and they should discuss about the issues they are facing rather than avoid, because if you avoid, the problem will not go away, it will remain there, it will worsen also. There is
Yeah.
nothing called like people cannot just because someone has a mental illness they cannot be terminated just like that. So
Yeah.
one has to understand if there are misconceptions, if there are myths, rather than gathering or hovering around those kind of myths, one should seek right scientific information, discuss with the right kind of person whether we have this kind of issues, should we we are working at some place, and do we have these kind of doubts and concerns, are those doubts valid or not, that will be good rather than avoiding or shying away from those kind of issues. Mental
Yeah.
illnesses can be treated, support guidance is available, whether in metropolitan cities or in smaller town also there are
Yeah.
people, non-pharmacological pharmacological interventions, but it is good to open up, good to discuss things at the early stages so that the morbidity, the disability and the lot of those suffering can be prevented or can be reduced.
Yeah. So also one of the question that I want to ask you is that what are the kind of methods that people can really look up to at this point of time as stress busting, or to kind of release that tension that they are facing because of their jobs?
To reduce the stress, basically what has been suggested and recommended, what is the lifestyle which people are having, like I have come across a lot of people who have called me,
Yeah.
like they have while they are working at home, they are not following the kind of life is the recommended discipline or schedule, like sleep pattern is just a late night awake
Yeah.
working or watching movies till late hours of the night, getting up late, the diet schedule is completely disturbed. So one
Yeah.
has to understood there are recommended guidance which is available, like one should have a healthy diet pattern which they should follow. Always if like outdoor sports activity is not possible, may not be possible,
Yeah.
at least some sort of sports activity, exercise, yoga or meditation is necessary, that they should follow. They should also have a routine which is structured in the way like sleep pattern, the timing for sleep, the timing or duration for their leisure activities, interaction. They should also have some sort of this thing on a day basis or on weekend basis. The social connection, the social integrity has to be strengthened with friends, with relatives. So over the phone, video calls, those kind of activities, some sort of gatherings which can be virtual, that gives strength. Apart from that, if there is a need, if there is a much more difficult issues, then they should go to psychiatrist or psychologist to
Yeah.
discuss what can be done at
Yeah.
that particular moment of time.
Yeah. So what we've seen is that in the recent times there have been people who have even committed suicide, who've taken the extreme step because of the job losses, because of their facing the mental issues, because of the stress in the job. So how do you see this? That right? Of course, it's very important to realize that we are facing such mental issues, but there have been people who've taken that extreme step. So how does the family deal with that kind of stress that happens when they lose a person because of the job, and how should the other people look at that particular incident?
See, suicide is a very important aspect right now, because and it has numerous causes, mental illness apart from job loss and all sorts of. If we look at the data which has been recently published one of the common reason which has been cited in the suicide occurring is fear of infections.
Yeah.
Apart from that, job loss, unemployment, financial crisis, worsening of pre-existing mental health conditions if they have. So all these kind of issues one has to deal. So there is a need for right kind of information because lot of misinformation is also flowing. People are common people, if they do not understand the approach in a right way, they might take extreme step. Although there is a work going on, research work regarding development of vaccine treatment,
Yeah.
the social media messages may misguide, saying that there are no treatment available or the
Hmm.
infection. If we see the negative news, the
Yeah.
cases, number of cases rising daily. If one
Yeah.
engages so much, so that they have persistent negative news, support system is weak, the coping skills they have, personality is issues, all these factors will compound. The approach should be one should limit engaging in those negative news. One should
Yeah.
develop or strengthen whatever the support system. If there are pre-existing mental health issues, always be in touch with the treating psychiatrist. Do not stop medications on their own. If you see any kind of mental health issues, whether sadness or suicidal thoughts, immediately seek some professional help. Discuss with your colleagues or friend and take necessary cautions which
Yeah.
are required or professional guidance. Suicide is a very important topic which we need to discuss in more detail regarding preventive. There requires like job loss. If you look at US, Canada, some parts of
Yeah.
country, developed nations, there are also these kind of reports which have come out. Although the reason may not be same which we are seeing in India, but suicide is a major concern right now. Preventive steps, universal models as well as selective interventions both have been advised, which can be discussed on a broader scale.
Yeah, so sir, to wrap up this entire discussion, can you just give a few points which you would like to say to people who are facing all these kind of mental issues, mental stress, and people who are even at the verge of identifying whether they are really having a serious issue or not? Because if these kind of issues are ignored at this point of time, they can even lead to depression. Because we know that this coronavirus pandemic might continue for even more months. So there has to be a strategy when it comes to the work pressure. We have to deal with it. So what are the few points that you would like to say to wrap up this discussion?
Yeah, most important issue will be one has to understand that the situation will remain slightly stressful in the coming weeks or months also.
Yeah.
Whichever place you are in, whether you are in Delhi or outside Delhi or in government sector or private sector, try to gather information which is right. Develop your support system, family, peer support, friend circle, and from the organizations you are working in. At any point of time, if you feel that your you feel psychologically unwell or kind of, whether it's sleep related problem, whether you feel anxiety, whether you feel sadness, whether you have negative thoughts which are worrying you, immediately you should discuss with your near your colleagues or friends. If you are not able to adjust or you are not able to find any guidance, then there are guidelines, helpline numbers available. There are mental health professionals available. So reach out to them and discuss. Do not shy away, because if you hide, the suffering will continue. One has to
Yeah.
understand, one has to, this is not the time where one has to shy away, because these are very important concern. The pandemic is a massive public health emergency and mental health is getting affected very badly.
Yeah.
So please reach out whichever place you are in. There are helpline numbers, there are people, NGOs, there are support system functioning. The collaboration between public and those uh, healthcare sector is very important. So discuss and take help immediately if
Yeah.
needed.
Thank you, sir. Thanks a lot for joining us. So I hope this discussion was fruitful, helpful to all those people who are battling mental stress, mental issues under this lockdown, who are working from home. It is normal to face all these kind of mental issues. So do talk to your friends, your family, your colleagues, and tell them that you are facing certain issues and find a way out to deal with this stress, because we know that the pandemic will be there for some more time. We still don't have a vaccine. We see the number of cases are increasing every day. So At this point of time, we have to stay strong and positive and fight this coronavirus pandemic together and fight the mental issues, and do not shy away and do not think that we are the only ones who are facing these issues. Most of us are facing issues in some form or the other, and so we have to be there for each other and help each other out. Keep
Yeah,
watching One India.
nicely, yeah, nicely summed up. More importantly, is these kind of discussions should be held time to time, and public
Yeah.
should be made aware that they can understand wherever there is lack of awareness on these issues, to destigmatize mental health related aspects and promote help seeking behavior, those kind of aspects. So
Yeah.
that will only come when we have lot more these kind of discussions. Suicide has become a major concern nowadays that requires tremendous attention
Yeah.
right now.
Yeah. Thank you, sir. And keep watching us on One India English, and we will keep bringing out all these discussions on mental health issues, and we'll be helping you out to understand that how to deal with this kind of stress, because the pandemic is there to stay. We hope that it ends very soon, but we do not know what is going to happen in future. So at this point of time, let's deal with the stress and let's stay strong.